All right, now here's the biggest plot twist. Even biology is open source. And here's something that might surprise you. This open source versus closed source pattern doesn't just apply to technology, it shows up in biology too. Let me give you a quick example. And this is also one of my favorite ones because I love science and a lot of things to do with the body, just everything. But because this is a trending topic as well, and you may know somebody or you may be using these things too, then this is going to be helpful. So, peptides, nature's open source code. So, peptides are short chains of amino acids, essentially biological instructions that tell your body how to heal, grow, and function. The amino acid sequences of peptides like BPC-157, which deals with tissue repair, and GHK-Cu, which stands for copper, is skin regeneration and wound healing. And others are publicly documented in open scientific databases. Okay, so the databases like Peptipedia catalog millions of peptide sequences freely available to any researcher in the world. That's open source biology. Okay? AI tools like RF peptides, built by researchers at the University of Washington from the same lab where David Baker won the 2024 Nobel Prize, can now design entirely new peptide structures computationally. And those AI design tools are open source. All right? But here's the catch. The pharma industry builds closed walls around it because this, again, is dealing with what we were saying about how open source is open, but you can monetize it, right? So that's that part. So those closed walls around it, pharmaceutical companies can't patent the naturally occurring peptide sequence itself. That's nature's code. It belongs to everyone. What they do patent is the delivery systems, the specific formulations, the manufacturing processes, and the branding. Okay? The clearest example everyone knows is Ozempic or semaglutide. It's a GLP-1 receptor agonist peptide. The science behind GLP-1 peptides is publicly available research, but the specific formulation, delivery method, and brand, that's a multi-billion-dollar closed system. The FDA is actively tightening restrictions on compounded peptides between 2026 and 2025, making it harder for independent pharmacies to produce versions of peptides that pharma companies have commercialized. So this is where you may see other types of peptides like GLP-3s, triple agonists, and just plenty of others, right? That's a whole rabbit hole on its own that is very helpful, that has helped a lot of people heal in ways because, again, this is something that naturally occurs within you, right? But of course, always check with your doctor first. But the connection is the source code is free. The business model is closed. Sound familiar? It's the exact same pattern we just saw in tech. Linux is open source, but Red Hat built $1 billion business on top of it. Bitcoin's code is open, but Coinbase is a publicly traded company. Nature gave us peptide sequences for free, and Pharma built a $50 billion industry around packaging and delivering them. Open source creates the foundation. Closed systems build the business. So the question is, who benefits and who gets locked out? And yeah, it can be locked out because once it's a closed system, then the regulations come in and so forth and so forth.